sono dei crawler, ci li guido io a capire qual è il vabbè.
Jadi ya sabun ayakal walore na eke chona ki chanyarang ki kwatu toku mukuma ki chonga tonga nalapatu ara pakanga ternganga tu yakal ngoncha patu tadaun ayai ayak apa bungini tangalek to yakalore ayai ni akagum ta kayonga ta yakalore kachi akala lo yayama
Ay, umum na pena ka?
Arena aya kade abango ni ebe to akala kala kai be men baraka ni ay ya daun bo cholo tanya gumi ayo ni boy ka daun bo lo tanya boy yo ayo ni gumi otera banyo ya pela kalike ambo chonya kigom mo chonya kigom ambo bo ngoralo na kwa
Nanga?
Aqua.
Aqua. Let me see. Okay.
That's the most important use. You use the cow skin also for dressing. You make a dress out of it. You take cow milk. You eat, of course, cow meat. It is the biggest cause of troubles in itself, because we have this culture of raiding, grab the cows forcefully in a fierce fight, usually leading to death of people. My late father was killed in one violent raid when I was 12 years old.
Hello?
Hello?
Yes, Philip. How are you?
Ah, fine, thank you, Giovanni.
How's Cotido?
Cotido is fine. You're very
Fine.
welcome. Yes.
Sorry,
very
I delayed
welcome.
a little bit, but
No,
you
I
know,
know.
the road is
The
not
roads,
so completely good.
yeah, and the rain and everything.
So, Dr. Talamoy is not around?
No, he's not around. He's
Okay.
taking an official trip somewhere.
Okay.
But I should be able to take care of things in the district. Yeah.
Very good.
Our program for today, we are going to visit the health center for the referral unit, Cotido Health Center 4.
Okay.
We see how they do the activities. Then probably later in the afternoon, we should be able to visit our kraal.
So you are the one. So I think it's better to go. Eh? So
Yes,
the
for
time
sure.
is our
sure.
enemy. Okay, we go.
Okay.
But you know, I would like to see the theater.
Sure. The theater is over there.
So normally, how many interventions you have in the theater?
About 10 per month. 10 Health Center 4 theater has been working for about slightly over a year now.
Nice to meet you.
Joyce, she's the nurse in charge of the theater. Actually, we are preparing. We have a mother who are just getting ready to do cesarean section.
Very good.
Yes.
Are you the one?
Yes, I'm the one going to do the cesarean section.
Just now?
Yes, the community has really appreciated our role here. And it is me and how I want to.
Fine.
Yes.
How many beds you have actually?
Around 28.
28.
Yeah, around 28.
Most of the beds are occupied.
Yeah, they are all occupied at any time.
Okay.
You have the machines and other equipment. But also, like issue of the bed sit, sometimes you give this patient, they disappear, they steal it, and so forth. Chora? Ah, yere. Huh? Huh? Yeah. This one maybe the attendants are not there. Maybe the big problem there. Some problem.
The nearest referral center or where such a mother can access facilities is over 80 kilometers away, so it is absolutely crucial that such services are available in the district here, and we hope we shall continue to offer these services. 4 kilograms. This one 4 exactly. Okay.
Yes, we found each other.
Nice to meet you.
You're most welcome.
Thank you very much. Okay. Here, I just visited friends working here.
And when was that?
It was 91, 92.
I was
Long
still,
time
I was
in
still
the-
very small.
Yeah, in the school.
Not even yet in the medical school. Eh?
Yeah, the same.
Yeah. But I've been here since 2003. So I worked here for 6 years now.
Yes. There's the patient.
If you look at the daily statistics, for example, this is for the last up to 1 week. So usually we have an average of about 8, 90, but the number is beginning to rise. Following the rainy season, usually we have a terrible epidemic of malaria here.
Measles, for sure.
Measles, diarrhea. In the next few weeks, we can go up to 200, I can assure you. And then it is really a disaster here. We cannot guarantee a quality service.
Yes. So, welcome.
Half an hour.
No problem.
As I told you.
Okay, let me have a look at the stock cards.
Okay. Then paracetamol. Oh, you are on elastin.
Yeah.
Oh, quite a number of patients this month. Eh?
Yes.
What are the commonest illnesses usually have?
Illnesses they have one is malaria.
Malaria,
And then RTI.
RTI.
We also have intestinal worms.
Okay.
Yeah, and then skin infection.
Okay. Coatem. Every month.
Every month.
Somebody has to come here to
Okay.
supervise activities. Yes.
Very good.
To see how
The unit is running.
the unit is running. We want to check they're filling the stock card, the OPD register.
I think we can come out to discuss outside.
Okay, okay.
It's better, a lot of light.
So, how was the security situation been like? Have you had any problems, any difficulties?
The security situation as we came here, because there was that fear we shall be raided any time, but it didn't happen.
It didn't happen.
But all along we have stayed without any problem.
Okay.
And we have just received even a message this morning that they had a peace meeting between the people of GA and Moroto. That's the Matheniko.
Okay.
So the weather situation, we have a problem. We have the bowl down this way, some 500 meters.
Yes, but is
it got broken yesterday.
Oh.
The water now we are taking is that water.
You have some, do you have purification tablets?
No.
I just advise them to.
No.
Okay, thank you very much.
Thank you.
Thank you, madam.
Yeah.
Please keep doing the good work. Eh?
Thank you.
Any problem? Make me aware. It's a hard place. It's inaccessible. In Uganda, people think it is at the end of the world, but the major thing is that the work here is quite enjoyable. When you're here, when you achieve something around here, you really feel you've done something, you really feel you are making a contribution to the disadvantaged people in Uganda. The socioeconomic status of the people here is very, very low. To solve some of the solution is really not to focus on just one area, let me say health, but we really have to improve the life. Then we can really get to notice a change here in Karamoja. But you tell them to keep our health workers very well.
5 years ago, you would see men carrying Kalashnikovs here very freely like walking sticks. But now you don't see, because there has been an active government program to remove these guns, trying to pacify these people. The most successful disarmament, I could say, is mental disarmament, because that's where the problem is. If you don't disarm the mind, they can still look for the gun when the opportunity comes, because these guns will continue to be there. Really, to change this society, we need to put massive investment in education.
The level of illiteracy in the community is quite high. And this has got an impact on the health-seeking behavior of the community. It even means that people tend to come to hospital, for example, to seek for health care when they are extremely sick. After a week, after a month, or several months or so. And by then, it is very difficult sometimes, you know, to change much, you know, about their health. So this kind of habit sometimes contributes to the high mortality rates in some of our departments, especially for the inpatient care. The schools around do not have the kind of facilities that could inspire somebody into such a challenging profession like a medical doctor. It's so difficult that from the kind of education that the natives of this place receive, that they can make it to the university to train as professionals, to become doctors, paramedical staff, to be nurses. It's extremely difficult. Very few of them make through. I'm just only one of the lucky ones.
James and Bruno. Good morning.
Nice to see you.
How are you? Dr. Bruno, welcome.
The kind of people who come to work here, most of them are people from elsewhere. They only come here for a while, and so you have to compete favorably in the job market to hire, to get them come here. It's not easy. We have to go out there and convince them. Sometimes after getting, maybe for one reason or another, they tend to change their mind. There is no, you don't expect to find a swimming pool in the surrounding, a lawn tennis court or something, or to go and play golf. This is not the kind of environment that we have here. So it is all about waking up to go and work. So because of this kind of situation, we have a high staff turnover, staff attrition rate. So it's not only because of lack of these other facilities, but also because there are so many patients who come here to seek for the services. Last year, for example, we treated 39,000 patients. It means that there were people coming from other districts, even outside Karamoja. So the workload is so stressful in some moments to the staff.
And the project that Dr. Bruno is going to be working under as the project manager basically is this one of support to the nursing school.
Anyhow, I'm happy to be here with you, and I'm supposed to be retired from my work in Italy in 2 years' time. So I did this choice to spend this time with you here. Thank you very much.
Which dissolves and destroys the enemy. There are a lot of diseases and there are very many patients who are suffering in the hospitals. So I took this initiative of coming to this profession simply to help our brothers and sisters who are suffering in one way or the other.
Since I started primary, I chose to be a nurse simply because I wanted to serve humanity where they suffer.
It is the only school in Karamoja, and the nurses who are qualifying from Matai, they are more competent, or like when they come up with good morals of the nurses profession. So that's why I said, let me go to another school of nursing.
Karamoja